Welcome to the Monitor and Assess Your Performance workshop for residential and home care services. My name is Jessica Eade and I am from the Aged Care Quality and Safety Commission. I'd like to begin with an acknowledgement of country. In the spirit of reconciliation, I acknowledge the traditional custodians of country throughout Australia and their connections to land, water and community. I pay my respects to the elders past, present and emerging and extend that respect to all Aboriginal and Torres Strait Islander peoples. This presentation includes information as well as opportunities for reflection and self-directed learning. You'll be provided with reference material to read at your own pace to assist with your self-directed learning. You can pause or rewind at any time to reflect on or consider any questions raised throughout the presentation. This session is to help you understand the principles and benefits of self-assessment, understand how monitoring and assessment activities feed into continuous improvement, such as risk, complaints, and incident assessment and monitoring, and use consumer experiences to demonstrate performance against the quality standards. Here is what we will be covering today. We will start by briefly talking about the aged care quality standards and their consumer focus. We will then move on to self-assessment, focusing on the principles and benefits of self-assessment and the collection of evidence. Next, we will look at continuous improvement through risk, complaints, and incident management. And finally, I'll provide you with some useful resources to help you to monitor and assess your service. Before we begin, I just wanted to highlight an important note about this session. The quality standards and information that we will be discussing today are about the existing aged care quality standards and not the draft strengthened standards expected to be introduced with the commencement of the new Aged Care Act. The existing standards will remain in effect until then. The Commission's website has more useful resources to learn more about the draft standards, the proposed audit methodology, and the new regulatory model. So please take a look if you haven't already done so. So let's begin by taking a look at the aged care quality standards and how it is consumer focused. While our focus today is on the aged care quality standards currently in place in the sector, the same concepts and principles apply to other standards against which you need to determine your level of performance. Now let's start by looking at the current aged care quality standards as assessment is against these standards. There are 8 standards and 42 requirements in total. Each standard focuses on different aspects of how you provide and ensure the quality of care and services and represents a minimum or baseline level of performance which providers are required to meet. Some of the quality standards or specific requirements may not apply to all home service providers, so you need to understand your unique service environment to determine which quality standards apply. If you would like more information on the standards, look at the guidance and resources for providers, which includes information about the purpose and scope of each standard, the intent of each requirement, reflective questions for consideration, and examples of actions and evidence. These provide an indication of what the Commission will consider when assessing compliance and can help to inform the self-assessment process. The Commission has also created a guide to assessment for Commonwealth Home Support Programs, also known as CHSP services, to provide an indication of the standards that apply to these home services. Visit our website, agedcarequality.gov.au, and look under the Resource for Providers tab for a copy of these documents. In addition to these resources, the Commission has developed an online presentation on the quality standards, which you can also access on our website. We will take a moment to pay particular attention to Standard 1, Consumer Dignity and Choice. This is because no matter which standard you are considering, all the standards are focused on consumer outcomes with the consumer at the centre of care. So the Commission is particularly interested in the outcomes you achieve for your consumers, how you know what is happening for your consumers, and that you seek to make improvements to consumer outcomes. Now that we have looked at the purpose of the quality standards, it's time for some reflection on practices within your service. You could consider what areas are of risk at your service, how you are managing these risks, areas you're doing a great job or where things are going particularly well, achievements for your service or any gaps you've identified in your practice, and other opportunities for improvement. Pause the video here and have a think about how your service is meeting the quality standards and outcomes for people you provide care and services to. Now that you've had a moment to reflect on practices within your service, pause the video here to have a read of some of the options on the screen to confirm ideas you might have considered or give you some ideas for things you could put in place. Now that you have reflected on some actions and processes you have at your service which help you know you're delivering quality care aligned with the outcomes of the aged care quality standards, we will look at applying those ideas within a structured self-assessment process. We'll talk about the principles and benefits of self-assessment and the collection of evidence. Self-assessment is an important part of the continuous improvement cycle for all aged care providers. Self-assessment is an opportunity to evaluate performance against the quality standards, to review results for older Australians, and to assess the effectiveness of any improvements. You want to know how well you are performing at any point, including before an assessment team undertakes their assessment. Undertaking regular self-assessment helps you to be confident that you are delivering safe, appropriate, and quality care and services at all points in time. Completing a self-assessment will also provide evidence that improvement has taken place and assist in communicating a provider's success. The Aged Care Quality and Safety Commission rules allows the Commission to request self-assessment information from a provider at any time. Your self-assessment information helps to provide supporting evidence that you understand what is required under the quality standards, understand your service's areas of risk, and are taking action to address those risks. It also demonstrates the level of a provider's commitment for continuous improvement at the service. In completing the self-assessment, you should assess against each requirement of the standard that you understand the requirement in relation to the consumer outcome, apply the requirement, and this is clear in the way you provide care and services, monitor how you are applying the requirement and the outcomes achieved, and review outcomes and adjust their practices based on these reviews to keep improving. You may notice that this is a similar concept to the continuous improvement cycle. Pause the video here and take a moment to consider what the benefits are to your service in monitoring and assessing your own performance. So, what are the benefits to self-assessment? It is an opportunity to evaluate current performance and review results achieved for consumers, the workforce, and the organisation. It identifies your strengths, gaps, risks, and opportunities for improvement. It helps communicate with the governing body, for example, the board, owners, and leadership team, about performance and risk so organisation-wide strategies can be developed to support improvement. It supports you to build an organisational culture that understands the value of self-assessment to improve the safety and quality of consumer experiences and outcomes. It provides an opportunity for continuous self-assessment as the key to ensuring that you understand the people you are giving services to and what is important to them. It provides an opportunity to review and assess the effectiveness of your continuous improvement initiatives and how you are managing risks. And it promotes systematic reflection and performance analysis. The Commission has resources available to support you with self-assessment, including a self-assessment template that you may wish to use. However, it is not mandatory. There is no required format for self-assessment documentation because we recognise that providers are all unique and work in a wide range of care and service settings. Considering the Commission's self-assessment template, a section of which you can see on screen, there are 5 components which I'm going to highlight to you now. The first section is the specifications of the standard and its requirement. Consider which standard you are looking at and its requirements, and use the available guidance material for more information. The second section allows you to self-rate how your service is performing against a requirement. The options are exceeding, meeting, and developing. Remember, it is important to be honest as you need to provide evidence on how you are meeting these requirements. Rating yourself as developing does not mean ultimately you will receive a not met rating. It shows that you are aware of what your risks and opportunities for improvement are. Quality assessors will ask for further information on how you have addressed identified issues and actions you have taken to correct or improve issues, and will explore the current outcomes and consumer experiences. Next, it provides you with the opportunity to provide examples of actions and evidence to support your self-rating. This is your evidence. Think about what type of evidence you would like to provide. What do people tell you? What observations have you made? And what documents do you have that support what is happening in practice? Focus on the consumer experience and outcomes, not just describing policies and processes. The next section is areas for improvement. This section allows you to provide information on what plans and updates you are considering or have considered to improve in this particular area of the requirement. And the final section allows you to provide other information. This includes providing information about any other issues you feel are relevant to your self-assessment of this particular requirement. The self-assessment tool is available on the Commission's website, along with the guidance material for self-assessment, which will provide you with detailed information on what to consider when completing your self-assessment. I've talked about the benefits of self-assessment. Here are some tips to assist you with self-assessment. Involve your team. Involve people you deliver care and services to, as well as interested family members throughout the process. It might be useful to review and update the self-assessment regularly so it continues to develop over time. This will also assist with updating the plan for continuous improvement. Set dates to constantly review as an ongoing process, not just as a one-off. Think about examples and evidence. Focus not only on policies but the experiences of people you provide care and services to, and the results you are achieving, examples and evidence. Be open and honest. There are also some additional steps you can take to ensure that your self-assessment process helps you to improve. For example, you can link improvement opportunities to your continuous improvement plans, report findings within your organisation, example, the governing body, include hyperlinks to key documents with your self-assessment to make it easier to find the relevant information or results. As mentioned, when you are undertaking your self-assessment process, you should collect evidence to show how you are meeting the standards and outcomes for consumers and to test the effectiveness of your policies and procedures. Evidence needs to be relevant to current practices at your service. This might include explaining why your practice has changed. Evidence does not have to be in a specific format, but it must be possible to review it. It is also important to note that evidence will be different depending on the type of care and services you deliver. For example, what you would deliver as a residential care provider will be quite different to what you would provide if you are a CHSP provider delivering a meal or transport service. Whatever the evidence, it should help you to demonstrate that you understand the requirement, apply the requirement, monitor how you are applying the requirement and the outcomes achieved, review outcomes and adjust your practices based on these reviews to keep improving, and this we discussed earlier in the presentation. Now think about how you may collect evidence. Interviews. You could interview consumers, families, nominated representatives, staff at all levels, allied health, contractors or brokered services, volunteers and board members. Observations, these may vary depending on the types of care and services delivered and whether you provide home care or residential care. For home care services, this might include observations like homes being safe and clean, consumers' appearance, the access and egress options in homes, the appearance and taste of food, social connections and interactions people have, equipment used, as well as conducting visits to homes to test your processes and confirm information. For residential care, observations may include things like the service being fresh and clean when you first walk in, residents moving freely around with ease and looking happy, the appearance and smell of foods, access around the service, and how staff attend to interact with residents. Documents. Think about the types of documents you use in your service. All of these can form evidence that relates to your performance. Some examples include feedback forms, meeting minutes, audits and assessment documentation, information from your incident management system and risk register, hazard reporting, complaints records, care and service plans, medical information records of discussions with consumers, maintenance records, transport schedules or diaries, clinical data and information about dietary requirements. When collecting evidence for self-assessment, it is important to understand the linkages across the quality standards. Some of the evidence you collect will align with more than one standard, so you can use the same evidence rather than repeating the process. As you can see on screen, the table shows you the linkages across the quality standards. For example, Standard 1 sets the foundation for having a consumer focus through the consumer dignity and choice lens. A consumer outcome focus and partnership needs to be the starting point and an ongoing part of everything you do every single day, from the smallest task to a major project, with every single staff member having and practicing this consumer focus. Standard 7 is about the people, staff, volunteers and contractors that deliver or provide care and services and therefore is connected with all the other standards. Standard 8 is about overall organisational performance, accountability, outcomes and improvements. This is also intrinsic to all of the other standards. Now it's time to have a look at our next topic, continuous improvement through risk, complaint and incident management. All aged care providers are required to have a written plan for continuous improvement under the rules. The Plan for Continuous Improvement sets out how the organisation will comply with its continuous improvement obligations under the quality standards and how it will make any improvements that are needed. Undertaking a self-assessment is an effective way of developing and updating a plan for continuous improvement. You might remember that I mentioned that link earlier with the standards. Relevant elements from the self-assessment, such as identified issues, can be included in an updated plan for continuous improvement with details and planned actions to address the issues. With continuous improvement, your governing body is expected to drive, assess and monitor improvements to make sure your organisation is committed to quality care and services. This includes making sure your older Australians have a quality experience. When completing a self-assessment as part of your continuous improvement considerations, providers should also reflect on taking a risk-based approach to guide thinking and enable the monitor and review process of the quality standards. Complaints management and what it tells you. View complaints as a gift. It helps you identify areas that you need to focus on and where you may not be achieving consumer outcomes to the level needed. Support consumers to provide honest feedback on their experiences of care and services. And incident management through your organisation's incident management system, or also known as IMS. First, let's take a look at risk in both residential and home services. The Commission's regulatory strategy is based on a responsive risk-based approach. Risk-based means the focus of the Commission's activities is on the areas of greatest potential harm to the safety, health and well-being of older Australians. Responsive means the Commission responds to the context, conduct, and culture of the organisation it regulates when it decides what action to take. The Commission modifies its programs and directs its resources in response to the nature of risks to the safety, health, wellbeing, and quality of life of older Australians, and the circumstances and behaviour of the provider of the service or services that it regulates. Having a self-assessment mindset embedded in your system and culture provides the Commission as the regulator with greater confidence that you are demonstrating the capacity and motivation to manage risk and continuously improve. This also allows the Commission to understand the nature and frequency of compliance monitoring required and supports the Commission to focus on areas of greatest risk. It is important that you can understand risks within the sector, your organisation, and individual consumers to inform your self-assessment and to assist you in developing strategies for improvement, which will inform your continuous improvement plan. The Commission collects and analyses data to identify what are trends and risks in sector performance. The Commission produces a sector performance data report quarterly that you can refer to. We strongly encourage you to visit our website to view this report at agedcarequality.gov.au/sector performance. This report is relevant to all service types. The report provides useful data on how well the sector is performing based on data the Commission has collected from various sources. Two notable types of data you will notice in the report are service average metrics. This compares your service with service averages of similar types and sizes of providers. And secondly, sector-wide averages helps you to understand how your sector and peers are performing overall. The data collected identifies which requirements from the quality standards the Commission has identified as areas of risk due to the trends in non-compliance. This information allows you to situate yourself within the bigger picture, so from a sector-wide perspective, and consider if these risks are relevant to your organisation, service, or consumers. It is important to consider if they are relevant. Have you already identified and managed these as part of your own risk management approach? And if not, what might you need to do? Again, the Commission has developed a set of standard risk-based questions which will be asked at the beginning of a performance assessment by the assessment team. These questions focus on critical risk areas and priorities of the Commission, and they are based on areas identified from previous assessments, quality standard requirements that cause concern or often are not met across the sector, and as previously mentioned, this is the data collected from sector-wide averages. Risk-based industry alerts that form part of the Commission's current strategy. You consider these questions and see how well you are managing these risks or if they are areas of concern for your organisation, service or consumers. Examples of risk-based questions that are applicable to all services include: has there been any adverse findings by another regulatory agency or oversight body in the last 12 months? For example, Health Care Complaints Commission or similar, Food Safety Authority or WorkCover. What trends do your complaints data show you? What actions has the service taken to assess and minimise infection-related risks for the care of aged care consumers, including the impact of a potential coronavirus outbreak? To consider and apply these risk-based questions to your service, you need to understand your service's unique environment and the context in which it operates. For further information, visit our website and the link is on the screen as you can see below. Some examples of risks, like the management of dignity of risk, adequacy of complaints and feedback mechanisms, respect for diversity and inclusion, management and support of people living with dementia and being able to identify and respond to changes in the conditions of older Australians apply to both home services and residential services. Some examples of residential specific risks may include medication administration and management, infection prevention and control practices, falls prevention and post-falls management, representative or family consultation and communications, pressure injuries, restrictive practices, and personal care and oral hygiene. Examples of home service specific risks may include mutual consent, unspent funds, high use of subcontracting, support for high needs of vulnerable consumers, providers new to the market which have not delivered residential care previously, social isolation, and unfilled shifts. Examples of risk management responses that we commonly see include risk management systems that identifies and evaluates incidents and near misses, risk management plans, governance oversight of risk, monitor risk to consumers and others, and take action if risk has increased. Ongoing self-assessment will give you confidence that you know what is happening, including identification and management or risks specific to your service and your consumers. This slide is only relevant to home services. The Commission has several resources available to support home services governing bodies in 5 key areas of risk that have been identified through the analysis of complaints, performance assessment, compliance outcomes, and other data and intelligence. Alongside the guidance document, which you can find on the Commission's website under the Providers tab, there is also a risk checklist attachment of the document to help you examine your organisation's performance and identify areas for improvement, and a recorded workshop on the key risk areas. These resources will help you to critically review your performance and identify any areas for improvement, as well as helping you to develop and maintain effective governance systems and processes to meet your obligations and deliver safe and quality home services. Briefly, these key areas of risk are organisational governance. A lack of oversight or inadequate organisational governance means that providers are less able to identify deficiencies and continuously improve. Care planning and assessment. Failure to undertake appropriate assessment and care planning can deprive consumers of the care and services they need. Clinical care. Poor clinical governance can result in poor outcomes for consumers, even where clinical care is not being delivered. Vulnerable consumers. Failure to identify and appropriately support and monitor vulnerable consumers can lead to particularly poor outcomes for consumers who are already at risk. Management of package funds. Inappropriate use of home care package funds or failure to consult with consumers regarding fees and charges can result in consumers receiving care and services that do not meet their assessed care needs. This next section applies to all aged care service types. The consumer experience and outcomes play an integral part in your continuous improvement and risk management process. You need to engage with consumers to identify what is important to them. Involve consumers in the development, delivery, and evaluation of care and services. Next, we are going to explore complaints and feedback. Think about your complaints and feedback process and how you know they are effective. Pause the video here and take a moment to consider what processes do you use in your service and how do you know they are effective? Complaints are a subset of consumer feedback. Providers need to have ways of collecting complaints so they understand what consumers aren't happy about and identify where there may be trends in complaints. You can manage your risks by analysing complaints information to give you meaningful data. This will enable improvements to management systems, cultures, and practices to ensure and sustain improvements. If your service has no complaints, it could mean that consumers are either fearful about making a complaint or they don't know how to make a complaint or access an advocate. These are some questions to think about. How do you encourage complaints and feedback in your service? What is your process to view and respond to a complaint? What are your top 3 trends in complaints? How do you use complaints data in your organisation? As providers, you need to have a robust complaints and feedback system that values and encourages feedback from consumers. You need to consider the diversity of your consumers and not take a one-size-fits-all approach. As providers, you need to establish a good complaint collation system. Information gathered during the complaint resolution process is used to inform the Commission's regulatory and education functions. The information gathered helps us understand the relative risks and aged care providers' compliance with the quality standards and the behaviour of the provider in relation to meeting its broader responsibilities for delivering quality care and services. As mentioned earlier, the Commission has developed a sector performance report that is updated quarterly. It includes information on the 10 most common complaints. We strongly encourage you to have a look at this report and consider if these complaints are risks at your service and how will you manage these risks, including identifying opportunities for improvement. Incident management systems are used across a wide range of sectors to allow organisations to identify, assess and resolve incidents to quickly address risks and improve the safety and quality of services provided. Incidents should be reviewed and assessed so that you can learn from them as part of your continuous improvement process. Effectively understanding this process can help you make good decisions about managing risks within your own unique services environment. You can use the self-assessment process to link up the incidents in your services IMS with the relevant quality standards. See what evidence you can gather, rate your services performance, and have an action plan in place to address these risks. Today, we have discussed the importance and benefits of self-assessment, considering risks, complaints, and incidents that can inform continuous improvement and your self-assessment process so you can deliver positive outcomes and high-quality services for consumers. Now it is your turn to apply what you've learned and think about how your service focuses on understanding and describing the quality outcomes for consumers and using consumer experience to demonstrate performance. As you reflect on your service's performance, think about examples of outcomes for your consumers that you have achieved and how this can be used as examples in your self-assessment to demonstrate results you have achieved, either for an individual, a group, or the entire population of consumers you provide care and services to. For those of you who have not started on your self-assessment, here is a checklist. For those of you who have started or completed your self-assessment, ensure your risks, complaints, and incidents have been considered and that you have linked your findings to your continuous improvement plan. Consider setting review dates for your self-assessment so that you're staying up to date as changes happen within your service. I have mentioned some great resources throughout today's presentation, so make sure you take a look at our website and other resources listed on screen now. In particular, I would encourage you to subscribe to the Quality Bulletin as the Commission publishes key updates and information on a monthly basis. That brings us to the end of this session. I hope you enjoyed it, and thank you and goodbye.